In people with advanced dementia, eating and swallowing problems such as oropharyngeal dysphagia can lead to poor prognosis. The etiology of eating and swallowing dysfunction is usually heterogeneous, so its evaluations should be comprehensive based on an interdisciplinary method. Speech-language therapists, STs, are the most important medical staff providing rehabilitations to patients with dysphagia. But no studies have researched effective assessment and management procedures or developed guidance on best practice by them. In our previous clinical trial using the clinical pathway, we identified that STs play important roles on the interdisciplinary comprehensive evaluations for eating and swallowing disorders in the older patients with dementia. There was an indication that an street-related factor affects the effectiveness of eating and swallowing training. Especially when interventions were performed by a ST opposite the patient's sex, eating and swallowing functions were more likely to be improved. So, we conducted this study to verify it. This is a retrospective observational study based on a review of medical records. The participants were patients who had received interventions by STs between April 1, 2013, and July 31, 2022, through our original interdisciplinary comprehensive methods, clinical pathway for evaluating eating and swallowing functions. The eligibility criteria for analysis were as shown here. When the sex of the patient and the ST was different, the intervention was defined as an opposite-sex intervention and assigned to the sex-mismatched group, and when they were the same, it was defined as a same-sex intervention and assigned to the sex-matched group. The main outcome measure was eating and swallowing functions, which was evaluated by the Food Intake Level Scale, called FILS, and Functional Oral Intake Scale, called FOITS. FILS and FOITS were not significantly different between the sex-matched and sex-mismatched groups at discharge. However, in the multivariate logistic regression analysis, FILS and FOITS improvement were significantly affected by sex matching. That is, the odds ratio of opposite-sex intervention was 2.25 for FILS improvement and 2.96 for FOITS improvement. In older patients with dementia and dysphagia, interventions with mismatched sex between a patient and an ST can be more effective in improving eating and swallowing functions than interventions with matched sex. However, this study was retrospective and only a pilot study. So, more studies are warranted to prove this effect universally. Thank you for watching.